Hi, I'm Lorena from the Center for Suicide Prevention and Research at Nationwide Children's Hospital. I look forward to sharing with you some helpful information about what might make a young person go from thinking about suicide to acting on the thought. It's important to note that a single event does not cause someone to attempt suicide, but there are certain situations that can push people to take action. We call these triggering events. The most common triggering events are loss and conflict with peers or loved ones. That includes rejection, the end of a relationship, or the death of a loved one, including pets. Legal and disciplinary problems are also related to suicide attempts, as well as social isolation or cutting ties with one's community. Suicide risk is also increased by certain factors, like a person's own perception of themselves and the issues they're facing. It's important to note that although an individual may show increased risk factors for suicide, it does not mean that they will make an attempt. Some risk factors change over time, like access to lethal means, whereas others do not, like the person's gender. Critical individual risk factors include previous suicide attempts, access to firearms, sharp objects, medications, or anything else that could be used to harm oneself. Untreated mental health conditions, especially mood disorders like depression, anxiety, or bipolar disorder, and drug and alcohol use. Other risk factors at the individual level include discrimination based on race, ethnicity, and identity, being victimized, bullied, or subject to disciplinary action, adopting and adjusting to a new culture, which is a factor of importance for migrant children or children of migrant parents. Trauma, such as exposure to physical, emotional, or sexual abuse, and isolation or feeling like a burden. Some risk factors, like a suicide loss or discrimination, can also be present within a community. Other examples of this include seeing violent treatment and negative images of specific groups in media and on social media. In closing, nobody knows your child better than you, so it's important to pay attention to the signs and consider the factors that may increase suicide risk in your youth. Remember, risk factors do not mean someone will attempt suicide, but we should be taking the necessary steps to support our children and keep them safe before a crisis occurs.